Hi guys, Martin here from Align Chiropractic, and what I wanted to talk to you about today is something that we see super commonly, which is people that we're taking care of who are getting neck pain or other issues with their neck, where they are also super keen on their Crossfit, their F45 or their boxing or other forms of high intensity training. And the question they ask us is, do I have to stop doing my training for the injury to get better? And what I want to talk through with you today are things that you can do while you're managing an injury so that you're not making it any worse, and you can keep the gains that you've had from your training. You can keep the metabolic conditioning, you can keep losing weight, you can maintain muscle by keeping training even while you're working through the process with us of sorting out a neck issue. So first of all, we're going to get you to shift focus. So neck issues are often exacerbated by upper body exercises and things that are super dynamic. So people with neck issues often find doing sit-ups are really uncomfortable because it can strain your neck a little bit. They might find that pushing weight overhead is uncomfortable because of the position that your neck goes into. So what we suggest you do is move to some exercises, substitute exercises that are super comfortable, and often they are lower body exercises. So you can do air squats, you can do squats where you're holding a dumbbell or a kettlebell, you can do lunges, you can do almost all of the lower body exercises. You may find that more dynamic stuff, there's a little bit of a jarring, so we're talking skipping or box jumps or running, for instance, might not be comfortable. So we're going to suggest that you substitute and maybe do things on an exercise bike or do things where on a rower where you can make sure that you're keeping a more controlled cadence, but really importantly, you're looking after the alignment of your spine by making sure your head's nicely above your shoulder rather than coming forward. So what we can do upper body wise when we're managing a neck injury, often horizontal things, so horizontal pushing, so push-ups can be okay so long as you're keeping your posture really neutral. Horizontal pulling, so rim rows can be comfortable, even though perhaps say pull-ups might not be because of that neck extension that's involved with it. So key here then is focus on the lower body, get rid of really dynamic movements, so things that have jarring in them, and substitute for things, get rid of the overhead stuff in particular. So second phase, once we're working with people and we're getting some improvement in the way that their neck is working, but they're not 100%, then we're going to start adding in some things that are a little bit more dynamic, but are a little bit more forgiving on your neck. So as we're reintroducing things, we might go, you're not ready for box jumps yet, but you can do step-ups, for instance. You're not ready for skipping, but you can do single leg hops, for instance, as an exercise. So the key thing to remember here, if you're training with a neck injury, is first of all, you just want to wind things back, shift focus. You can get a lot of benefit in working lower body stuff. Then as things start to recover, we'll reintroduce things, but in a modified form that reduces how much jarring and how much movement of your neck is required. So important thing to remember is you can keep training through almost all injuries. The most critical thing though is to think through and get advice on what the things you need to avoid and what really clever substitutions you